Thanks for tuning in to the Red Clinic podcast. I'm Dr. Schwalen, licensed psychologist and expert in the treatment of eating disorders. Today, I'm going to talk about what to expect at your first therapy session. So, for a lot of people, going to therapy may seem like something they've never considered before. Or if it is something you're considering, you may be really nervous or wondering what to expect. And those are all very normal things to be thinking and feeling. So this is actually a cool episode because it kind of applies to all different kinds of clients. It's not just clients who have eating disorders. But some of the examples I'm going to bring up will have to do specifically with eating disorders so that I can make it more specific. So what I'm going to do is I'll kind of go over just what are some things that maybe myself as the psychologist would do or any kind of provider would do during a first session. I'll talk about what they would do if they were working with kids or adults, and also how they would keep the family or the parents informed. Now, keep in mind, everybody has their own different style, okay? So no provider is the same. And one of the most important things to do if you're seeking out a therapist or a psychologist to do some work with is to, I think I've said this in previous episodes, but to always make sure that they have a good in-depth assessment process. The assessment is key. You want to make sure they're spending time with you before they even start doing therapy with you, learning about you and understanding everything that could possibly be going on from every perspective in your life. So gathering history about who you are as a person, gathering history about your medical history, your family history, just anything that's really important that makes you who you are, those details that have kind of culminated together to bring you to this time and moment in your life where you're ready to start doing some work on something. After that initial assessment, you also want to make sure you give your provider or therapist several opportunities to really build that rapport and relationship with them. It's so easy when we're anxious or we're struggling with something to make initial judgments and make those judgments very quickly. So if your therapist does something that catches you off guard or you don't like, or you just felt uncomfortable or it was awkward, I'm going to tell you that that's really normal. That's super normal, okay? Think about like you're going to therapy for the first time, or maybe it's the second or third time, but it's still someone that you've never really met before, that are brand new to you, and the whole thing is set up for you to be vulnerable and open and share your thoughts and feelings and maybe innermost thoughts, right? And so automatically it puts us in a situation of, well, do I trust this person? Do I feel comfortable enough to even go there with them? And it can be very easy to quickly judge your therapist and say, oh, this isn't working. I'm not feeling comfortable. I no longer want to work with this person. And maybe you've only had 1 or 2 sessions with them. I'm going to say, a good rule of thumb is let yourself have, 3 to 5 sessions with someone before you decide that this is definitely not a good fit. Okay. Now, after the person has done the assessment and you've given it enough, you feel like you have a good foundation, you're ready for that first session. It can be uncomfortable, like I said. So I will 100% validate that and normalize that for you if you're thinking, I can't go to therapy. I mean, I can't go talk to a shrink. Does that mean I'm crazy? I've never imagined myself ever needing something like that. What does that say about me if I need to go talk to somebody? These are very common thoughts and feelings to have or concerns to have. The other thing that I want you to realize is that talking to a therapist, if you've never done it before, it is awkward. There's no way to get around that. Because like I said, you're going there to be vulnerable, and your therapist is most likely going to ask you questions that maybe no one else has ever asked you before. And that's how they can dive deep and get some really good work done. And I keep referring to it as work because it is. Therapy, just like physical therapy or occupational therapy or any kind of therapy where we're going in to rehabilitate something about ourselves, is hard work. It takes time. It takes commitment. It takes diligence. And it takes almost perseverance, right? Knowing that some days are going to be harder than others. And you have to give it a real chance to work. So if you're going to do this, you need to be wholeheartedly committed. I always tell my clients, make sure that this is a time in your life where you really want this. Make sure you're ready to be aggressive with implementation of recommendations. Because every week, if you leave here and you're not doing the work outside of these sessions, you're not going to get anything from this. You can't come to me thinking I'm going to cure you or fix you, okay? And for the parents out there, you can't drop your child off to me thinking 45 minutes a week is going to be what they need to be better. It doesn't work that way. The therapist is really a guide or your biggest advocate. There's someone who's going to see your strengths and cheer you on along the way. They're going to walk alongside you in this journey to whatever you're trying to accomplish, but they're not going to do it for you. So in a first session with a child or an adult, I'm going to take some time to do a few things. The first session is really going to be probably the most talking that a client will ever hear me do. Because after that, like I said, the expectation is that you come ready to do your work. But in the first session, I'm going to kind of introduce myself, let them ask any questions about me, and remind them even who I am, because I've already done an assessment, so I've had a meeting with them in the past. And then I'm going to review the limits of confidentiality. That's usually the first thing I do with clients at a first session and in following sessions. So I'm going to say something like, hey, everything we talk about is confidential. No matter what you say to me, I'm not going to go call your friends and tell them what you said or tell your parents what you said. I'm not going to call your teachers and share. The only time I have to break that confidentiality is, and then I lay out the different reasons why I would have to. A lot of them have to do with safety. So if a child or an adult were thinking about hurting themselves or if they were being harmed, I'm not going to keep that a secret. I'm going to do everything I can to keep that person safe. So I make that very clear. I also tell the client, other reasons why I may need to break confidentiality. Sometimes insurance asks for records or a judge might subpoena records for whatever reason. So I go over all of those reasons and give the client an opportunity to ask questions about that. Then I'll even say, hey, if one of those situations ever did arise and I did need to speak with someone else about something you said in a session, I would always tell you first. So I'll say, hey, remember those limits to confidentiality? Yeah, this is one of those times. So right now you can have the option to sit in on the conversation that I'm going to have with your parents or with your teacher or whoever, or I can just do it and let you know how it goes. What do you prefer? And then I'll even ask the client if they want to be the ones to tell their parents while I'm sitting there and supporting them while they're doing it. So it's very much this collaborative process of like, it's going to happen, so here are your choices. Like, what do you prefer about how it goes down? Then I always want to make my clients feel at ease. There's nothing you can say in here that's going to get you in trouble. This is a non-judgmental, real safe place. But I'll kind of review with my client if I know, like, they've never had therapy before. I'll say, have you ever had therapy before? Do you even know what to do in my office when you come here? Do you know why you're here? Especially if it's a child, I'm going to ask them if they know why they're here. After I get their response, I might be more detailed about why they're here. I'll share with them, your parents brought you in because, or remember last week when we did the assessment, we talked about these things. So even though I'm a doctor, I'm not the kind of doctor that's going to give you shots. I'm the kind of doctor that's just going to do a lot of talking. Depending on the age of the person that I'm working with, I might do different techniques to also help them feel more comfortable. So instead of just talking, we might be drawing, or we might have a game of cards going while we're talking, or we could be playing a board game. Because usually for kids, especially when they have something like between you and them and they're working on something, it's a really good distraction. It helps them with their nerves and makes it a lot more likely that they're going to start talking. And then I ask questions about, what are you thinking right now? Or based on the reasons that you're here, what do you think about that? What do you want to make sure we work on? So a lot of the first session is going to be a very collaborative approach to setting goals and making clear objectives for how we're going to spend our time. Now, as the professional, I'm going to have my ideas of what those goals need to be, and I'm going to share that. Hey, you're here for the treatment of anorexia. Do you know what anorexia is? And I might explain that to the child. And then I'll say, now here, let me tell you what that can look like. And I'll explain to them, the goals of treatment are to help you differentiate from your eating disorder. Because if you think you are the eating disorder and it's you and you can't really separate yourself from it, we're going to have to help you see that this is not who you are. It's just something you're going through, and help you separate from it. What do you think about that? And then I'm going to want a response. So everything that I even suggest, I'm going to ask my client either what they're thinking or how they're feeling about it. Now, a lot of times kids will say, I don't know. And that's a really common response. It's really common in adults too. And so when that happens, I will at first, if it's a first time therapy client ever, I will basically kind of help them understand, it's okay not to know. However, I do want you to know that you are probably having some thoughts and feelings right now. You're just not really in touch with them yet, or you're not used to telling someone everything you're thinking and feeling every time they ask you that question. Or maybe you're not used to being asked that question at all. And so when I ask those questions, I do need you to really stop and think for a second. We might talk about what different feelings feel like. We might actually define what different feelings are. So with kids, for example, I might pull out like a sheet of faces that show different emotions. And we might just spend several sessions just talking about the different feelings on that page. We might say, okay, have you ever had a time when you've experienced feeling confused? What did you do during that time? And this is my favorite, because this is that strengths-based approach of helping clients see that they actually have everything inside of them that they need to overcome any obstacle. So if a child says, well, yeah, I've been confused, at school when I have a question. Okay, when you have a question, what do? I raise my hand. Really? That's amazing. You have natural coping skills. You have a question, you raise your hand. So you had a feeling and kind of a problem, and you figured out how to handle it. So I normalize everything for them. I let them see that they have what they need. And then we take those baby steps and help grow and develop that person into really believing in themselves, into really understanding their different ranges of emotions and maybe what they do when they're having certain feelings, and breaking down real life situations. So week after week, the child might come back and say, okay, Dr. Schwalen, this happened at home this week and it's really eating at me. And they'll describe maybe an interaction they had with their mom or dad. And so then we'll break that interaction down. Say, well, how did you respond? What were you feeling? Help them feel understood, help them feel validated, but then also look at it in terms of, was there anything you could have done differently? How did you cope in that situation? What did that situation make you think and feel? And we're able to do something with that. Now, for parents of children, I'm a firm believer of I can't treat a child unless the family's involved. So it takes a village, right? So making a difference in the home setting is so important. It's, I think, very pointless to bring your child to me and say, Here you go, Dr. Schwalen, fix my kid, and I'll be in the waiting room doing some work. It doesn't work that way. So I will do a family therapy session also. And a lot of times those family therapy sessions end up just being parenting sessions of, hey, let me teach you about an eating disorder. Let me teach you what your kid is going through and what this means and why this is not necessarily your child just being stubborn or manipulative, but because they have this issue they're dealing with, let's help you understand that so you can have more empathy for your child. And then we might talk about changes in the home. How are you guys approaching meals? How are you approaching discipline? How are you approaching just communication between husband and wife or parents or parent-child, whatever it may be? And even just tweaking small things and how you approach your child and behavior management can make the biggest difference to your child. And this is all done non-judgmentally, but it requires you to be extremely honest. Because when you're in the room with a therapist who's skilled and trained, you're in the room ultimately with a scientist who's looking for data. And they're going to ask certain questions that you've really never been asked for. So what I like to also put out there is parents, a good therapist who's really used to working with kids is going to understand that you need updates. So minimizing your communication, between sessions is important to the therapist because they want to know, okay, at the session, you're truly listening, you're getting the updates you need. They're going to inform you if there are any concerns, but they should also be informing you about the positive things. Hey, today, little Johnny used the session well. I mean, he came ready with different things he wanted to work on and talk about. And then we also worked on learning about different feelings. So some kind of synopsis is absolutely okay to expect because then throughout the week, you're not going to be emailing or calling like, hey, is there anything I need to know? Or what did you guys work on? You shouldn't leave that therapist's office wondering those things. A good therapist is going to give you those updates and still honor that confidential space with your child. They're not giving you the play-by-play. They're not saying everything your child said, but they're at least giving you some kind of overview of how the session went. For adults, it's the same thing. It's building and establishing rapport in the first session, reviewing limits of confidentiality. I like to joke a lot to put people at ease. For example, I have a client who recently just told me, the mom said, I've made it a new rule that every time, so-and-so comes home from school, he's going to tell me something new that he learned. And it's kind of funny because he can tell me anything that he learned from his video games or from, things that he's interested in. But every time I ask him about school, it's always, I don't know, or nothing. And so I told him I was going to hold him accountable and he needed to really pay attention to what he was doing during the day because he would have to come back and tell me about it. And so then later on in the session, I just made a joke. I said something along the lines of, oh, that's really great. I'm going to make sure I tell your mom later when she asks me what I learned today. Right? And everybody laughed and it was fun because I brought it back to a point that was made earlier. So therapists have their own personalities and they will bring that out into session. You're not really going to learn a lot about your therapist. Usually it's a pretty good rule that therapists don't self-disclose. So, and that's like the clinical term, like only use self-disclosure when it's clinically indicated because we have boundaries. We are there for you. You're not there for us. You're not there to learn about us and our problems. You're there because you want help. But therapists do share things about themselves when it's appropriate. So you might know that your therapist has children or has a family. You might know how long they've been doing the work that they're doing. They're going to bring up things when it's relevant and important for you to know. Other things that happen on the first day in therapy. So limits of confidentiality, building rapport, making sure they just get to know you, but also not shying away. So you should expect that you're going to be asked questions, and you're not going to be able to get away with not answering them. You're kind of, it's you and your therapist. So it's a one-on-one conversation. Therapists are usually very skilled in getting a lot of information in a short amount of time. And they do it because they don't lead you a certain way. So I'll tell you another really good example of something that I might do is a client walks in for the first session. Hi, how are you? I'm good. Okay, well, what's good, right? I'm going to always follow up with that second question. And then the third question. And it gets you talking about things that you're not really used to talking, but it starts to feel good for you. Because you realize like this therapist is really listening to me. They're really understanding. And then they're also giving me clinically sound recommendations for what I should do next so that I can continue to improve and work on the things that I want to work on. That's part 1 of this series today. So today, I just really want to give you kind of an idea of what that first session can look like to take away some of that uncertainty or, I don't know, just misconceptions about what going to see a shrink might be like, right? Part 2, which will be next week, is about what does a therapy session actually look like? So I'm going to have a guest on this show, and I'm going to do kind of a mock session so that you can see what a client-therapist interaction may feel like or look like on video. I look forward to that time, and that's it for today. Thank you for tuning into the Red Clinic.